till now we have discussed type of acne, why the acne are occurring, why these comedones, whiteheads, blackheads are occurring, how it appears, and types of scar we discussed. Etiology was discussed. We left with acne vulgaris. And now let's begin with acne. We just left at the drug-induced acne. So let's begin with that. Yes, drug-induced acne.
So those persons who are on drugs like steroids, androgen or anabolic steroids, oral contraceptives, antitubercular drugs, or drug containing the iodides, bromide, anticonvulsant drug, those drugs having the side effect of producing the eruptions, which are look like acne. So what is anabolic steroids? They are man-made synthetic steroids,
Yes.
which are used by the athletes or bodybuilders to gain their mass.
When you see the bodybuilders, you just get the marks on their back, on their chest. When you observe them, you feel the keloid-like eruption. So those are the sign of taking external hormones or external steroids. So those are the typical drug-induced acne.
The drug-induced acne, the eruptions are monomorphic, not like acne vulgaris. Acne vulgaris having the eruptions, variety of eruptions like papules, nodules, pustules, comedones. But when drug-induced acne, they having the monomorphic, having the similar appearance to each other.
They are almost look similar to each other.
And they generally appear on a trunk area and less commonly on a face.
Yes. Yeah. Let me share your screen with you.
Drug-induced acne generally do not having the comedones, or when they are healed, they do not leave the scar. And generally they appear on a trunk and back and lessly involve the face area. Here's the next image. You can see the monomorphic appearance. The all eruptions look alike, and along with that you can see the stria, which are steroid-induced. So by which you can identify the drug-induced acne.
तो स्ट्रा के लिए कोई दवाई नहीं है.
They are permanent.
They are permanent. बहुत सारी फीमेल आएगी आपके पास. They came with such सर ये डिलीवरी के बाद मुझे स्कार्स रह गए हैं, या फिर मेरा वेट ज्यादा था, रिड्यूस्ड वेट, और उसके बाद स्कार्स रह गए हैं. Those are not curable. वो कम हो सकते हैं, रेडनेस वगैरह हो तो, लेकिन that is not curable.
Now the infantile acne. The child, or after the delivery, the child born, they get developed the acne. They are not due to the sebaceous gland involvement. They are due to the maternal hormones. They are mostly males are commonly involved, and soon after the birth they develop and they persist up to 3 years, and after that they resolve by itself.
Sometimes it get confused with atopic dermatitis. It is always confusing. Lekin how we can differentiate that atopic dermatitis with this infantile acne? Infantile acne is always seen on face, not on body. So in those cases, if it is atopic dermatitis, that can be on the folds, like elbow fold, like popliteal fossa, या फिर clubidal fossa. Those are the common site of atopic dermatitis or eczema in childhood. So if it is there, then we can think of eczema. Otherwise, that can be acne only.
The appearance and characteristic of acne are like adolescent acne.
वो पस फॉर्मेशन वाले भी हो सकते हैं या विदाउट पस भी हो सकते हैं.
Now late onset acne. Generally, acne vulgaris appear in the peripubertal age or in adolescence, but those patients who are developed acne after 25 years of age, then it considered as a late onset acne. Predominantly seen in women, then in men,
बहुत सारे फीमेल आती है कि सर मुझे 40 की साल के बाद एक्ने हुए या 35 की एज के बाद एक्ने हुए। मुझे टीन एज में तो मेरा फेस इतना क्लियर था कि एक एक्ने भी नहीं था, और नाउ इट बिकेम सिंस 6 months and her age is 35. That is called as late onset of acne.
Late onset acne should be differentiated from the other condition, hormonal disturbances like polycystic ovarian syndrome, or must be differentiated from acne rosacea, because acne rosacea is also seen in women, middle-aged women.
Yes.
So we have to differentiate from that. Now, acne excori. Acne excori is generally mild type of acne, but those patient or a girls who having the habit of picking up of their acne or scratching habit. So that's why they termed as acne excori. So you can see the scratching marks on their face.
बहुत सारी मम्मियां आके बोलती है कि सर इसकी बहुत खराब हैबिट है कि वो फेस के ऊपर जब भी एक्ने आता है तो सी जस्ट प्ले विद इट, और उसमें से जो दाना निकलता है सी रिमूव इट। सो दो जो रिमूव करते रहते हैं और उसकी वजह से जो एक्ने होता है, दैट इज कॉल्ड एज एक्ने एक्सपोरिया।
And the comedones are also present, but they are less intense. Here is the figure. You can see here the scratching marks here. So by which you can diagnose the acne exposure. They are generally mild kind of. But if the patient recurrently touching that area, so may affect the other area also.
एंड उसकी वजह से एक स्कार भी रह जाता है। तो पेशेंट को समझाओ कि इफ यू आर कंटिन्यूसली टचिंग दैट पार्ट, और वो डिस्कलरेशन क्रिएट कर सकता है, या फिर इट कैन क्रिएट खड्डा, तो विच इज नॉट क्योरेबल कंप्लीटली। तो प्लीज अवॉइड टू टच योर एक्ने, राइट?
Now the last is acne fulminans. Acne fulminans is generally acute onset. Generally, they appear in week or 15 days or within a month. Along with that, the patient having the complaint of fever, having the complaint of muscular pain or the joint pain. The appearance or characteristic of acne fulminans is like crusted appearance, superficial surface crusted, or having the superficial ulcerative lesion.
Yes. So when it is associated with acute pain or any acute condition along with fever, and acne is there, we can think of this term.
Here is the picture. You can see it generally appear on a trunk region. You can see the multiple crusted eruptions and ulcerative lesion also. And along with that, patient complaining of a fever, myalgia or arthralgia. Okay. So the classification or the types of the acne vulgaris here is the and
Particular kneecap.
now the course of acne. Generally, the acne remain up to the third decade or fourth decade, and after that, the scar become milder or the discoloration is removed, and the acne will not severely seen in third or fourth decade. So the course of acne is up to 30 years of age or the 40 years of age. Generally, the middle-aged woman complaining that persistence of lesion in middle age also. Now the investigation. Generally, no investigation is required for the acne vulgaris. But along with that acne, the patient complaining of other symptoms like hirsutism, virilism, or menstrual irregularities, or other androgenic symptoms. So for that, we have to go for screening test.
Yes, we have to find out the systemic cause of acne. If it is only adult acne or something else, that is completely clinical observation, that is completely we can differentiate or diagnose clinically. If we want to investigate or we want to rule out any systemic cause, then we have to rule out with the reports and all such things.
Now the diagnosis. So up till now, we discussed various time that this is the key point for the diagnosis of acne vulgaris. So now it's your turn. One by one, how you can diagnose a case of acne vulgaris. एक पॉइंट बताइए कि आप कैसे डायग्नोस करोगे.
and patient came to you with the acne, how will you differentiate it or how will you diagnose it? Anyone?
इतना सब पढ़ा है
As it is completely clinical, so guys, clinical ही observe करना है. Pustular.
इरप्शन कैसा है वो देखना है.
So generally the patient are in age wise we can see the patient in about adolescent age, means about 13 to 22 years of age. The skin of the patient, we can see the greasy oily skin or the open pores, multiple open pores, or along with that comedons. The eruptions are polymorphic, means there are multiple variety of eruptions, papules, pustules, or nodules, or cystic sometimes, various lesion or scarring seen along with the acne. The presence of comedons is the diagnostic for the acne vulgaris. And the area or the typical distribution of acne is on a face, shoulder, upper part, trunk, and chest. So by which you can confirmly diagnose a case of acne vulgaris.
Yes.
Now, differential diagnosis. Acne vulgaris must be differentiated from acne rosacea. So the characteristic of acne rosacea, generally they occur in a middle-aged woman, whereas the acne vulgaris is occur in adolescence age. Distribution of acne. In acne rosacea generally appear on the convexity of face, means generally the centrifacial, means the nose, cheek, or forehead are involved, whereas the acne vulgaris is distributed on a face, trunk, back, or deltoid region. Morphologically, the acne vulgaris, along with the acne, the comedons are the characteristic for acne vulgaris, whereas in acne rosacea, comedons are completely absent. Papules, nodules, pustules are present in the background. In acne vulgaris, skin are oily and having the multiple open pores. Whereas in acne rosacea, the patient having the great redness and telangiectasia.
उनके पास जितने भी रोजेसिया वाले पेशेंट आते हैं उनका टिपिकल चिक्स के ऊपर रेडनेस होती है. That is the indication of rosacea. Or in those cases we have to differentiate sometime from SLA. SLA में भी butterfly pigmentation होता है, that is a little bit brownish color. लेकिन sometime if it is in a teenage, so that is quite difficult to differentiate. It is SLE or it is autoimmune or it is rosacea. So in those cases we have to differentiate autoimmune and rosacea.
Now also acne vulgaris has to be differentiated from folliculitis. Folliculitis generally the perifollicular involvement of perifollicular region or terminal hair, whereas acne vulgaris are not related to the terminal hair but related to pilosebaceous gland. Comedons are absent in folliculitis, acne vulgaris having the presence of comedons. Morphologically, the folliculitis having the pustules and papules or sometimes nodules.
और जब भी एक्ने एक्जिला में इन्वॉल्वमेंट हो या फिर जेनाइटल हेयर के अंदर इन्वॉल्वमेंट हो तो फॉलिकुलाइटिस के चांसेस मैक्सिमम रहते हैं.